Hey everyone, welcome back to another intern interview. Today I'm here with Dr. Konstantin Kanakis. He is a recent graduate from American University in the Caribbean, where he went to medical school, and he matched into Loyola University out in Chicago, Illinois, for residency in pathology. And I don't know too much about pathology. I get a lot of questions on how to match into pathology, so I'm really excited to have him as a guest today to share with us his experience in Caribbean medical school and how he went about matching into pathology. So the first question that I tend to ask all of my guests is, how did you wind up going to a Caribbean school in the first place?
Cool. First of all, thanks for having me. I'm happy to talk and answer a lot of questions about pathology because you're right, nobody knows anything about path. So first of all, great. Second of all, my kind of trajectory towards going to a Caribbean med school is one that involved me being a little older than most applicants. I had actually worked for about 9 or 10 years after college in medical laboratories and things in hospitals. And I had actually went to grad school. I got a master's in that field as well. So when I applied, some folks during my first or my only cycle, but American schools were like, you're too old. You should finish your graduate studies and just do a PhD. Have you thought about this? And no one would really give me a shot until I got to AUC. So that's me.
That's very fair. I think that's a very different story than most people have. It usually involves grades, MCATs of some sort. So they just thought that too much schooling was bad for medical school, essentially, which is kind of crazy to hear.
Absolutely true. Don't get me wrong, my grades were not stellar. I'm not going to lie to anybody here. I'm not the best at tests. I'm not the best at looking good on transcript paper. But you try to go to grad school, you try to do things, you try to go to work, and it just didn't make a difference. So
Very fair. And I think an important thing to realize too is that being a doctor isn't all about grades. It's about being a good clinician as well, which doesn't mean being great at a standardized test. I think a lot of people are in a similar boat as us. I didn't have good grades myself. And I definitely didn't do well in the MCAT. So, and we both still made it this far.
yeah.
So next question that I have for you is, how long have you been interested in pathology? How did you become interested in pathology? Where did you actually get the experience to become interested in this?
Yeah, that goes back to my same answer about how I got to med school. Going to grad school and working actually kind of influenced me there. But I'll say that during college, you go to undergrad and you're like, I want to be pre-med, you do biology, you do all the regular things that everybody does to get ready for the MCAT and whatever. And you think, I'm going to be a doctor. I'm going to wear a white coat and I'm going to do stuff. But you don't know what that looks like because you're so green and young and you don't even know. But for me, once I decided to do a master's first and decided to work in clinical laboratories first, that's when it all kind of clicked, and I saw the depth of what they do in it's actually pathology and laboratory medicine is the whole like title of the specialty. So I got to see everything that falls within that scope, and I fell in love with it. Working for 10 years didn't hurt, immerse me in that field, but I really couldn't see myself doing anything else after that.
Okay, that's really cool experience, actually. And so just like to kind of piggyback off that, did you ever do any I guess, laboratory bench work research? And did you ever consider doing that instead of pathology at any point?
Yeah, at one point before I applied for my, I guess, med school cycle, I had thought about a concurrent application had like PhD applications too. I really thought about going down that route, doing research and doing a professional doctorate so I could be a laboratory administrator or something, but none of those really sparked that fire, you really want your DO because you want to do, direct clinical stuff. I'm being vague for various reasons, but yeah, I was told to finish the degree to continue to do a PhD or something, but it didn't really work for me. But I did have experience in some research in grad school. I did benchtop research, but the bench work that I did when I was working was direct patient care clinical diagnostic testing. And that's, that requires board certification, requires schooling and all that stuff, et cetera. So all that stuff put together pushed me further and further closer to medical school.
Okay. And so what do you plan on doing beyond residency? Do you plan on being a pathologist? Do you plan on specializing? And what types of fields are there to specialize in if you do a residency in pathology?
Good question. I feel like pathology is already so specialized to people that are outside of the field, right? There are as many, yeah, Yeah, there are as many subspecialties and fellowships within pathology as there are for all the other patient-facing specialties put together. Like, you know, OBGYN has like fetal maternal and all that stuff. Surgery's got everything from general to trauma. Internal has everything by organ. You can go like all through the list. Pathology has the same thing. And I plan on doing 2 fellowships, one in hematopathology and one in transfusion medicine. So I could talk about those too.
Yeah, go ahead. I would love to hear more about that because that's not something I've even ever heard of.
You got it. So pathology is split into these 2 sort of big groups, anatomic and clinical pathology. You can do a residency in both, which is what most of us do. It takes 4 years, and there is no intern year. You just jump right in. So the learning curve is steep. But once you get started, you can do either of those separately for 3 years or together for 4 years. That's what I'm doing that. Most people do that. And at the end, you usually apply for fellowships in your second year-ish. After your 4 years, fellowships are about 1 to 2 years. So I'm interested in hematopathology and transfusion medicine, like I said. Hematopathology is basically the pathology correlate to hem-onc.
Okay.
Yeah, so hem-onc in clinical patient-facing medicine sees patients, assesses any sort of solid organ tumor or lymphoma, leukemia type thing, and kind of manages you along that trajectory clinically. In pathology, we're the ones that get the bone marrow, look at it, find diagnostics, do investigative workups, consult with other pathologists. It's a really complex field of diagnosing, let's just talk about like a myeloid leukemia, for instance. You have to do all kinds of immunohistochemistry, consultation with other specialists, flow cytometry, all kinds of like investigative, diagnostic back to give the clinician, here is what you've got. Staging implications mean this, prognostic implications mean this. I'm moving on to the next case. And that's really like, it's really deep into like heme science. I really love that stuff. The other specialty I'm interested in is called transfusion medicine. You may have heard of it as blood banking or apheresis center management or any kind of thing. It all falls within that realm. Blood banking is taking care of all the transfusion needs of patients in the hospital. You deal with things like massive transfusions, trauma, accidents, surgical intervention, ECMO, things like that.
Okay.
Apheresis clinics do like LDL apheresis, photopheresis. There's all kinds of stuff there. And you also manage things like cellular therapy, bone marrow transplants, and the list is very long and I'm not going to go into all of it, but like that's the stuff that gets me going.
That's very cool. And I'm sorry to be completely disregarding the questions that I actually like plan to ask, but I'm very interested in this particular topic that you're talking about now. So in terms of the learning curve, I feel like most of us go from, third and fourth year of medical school where you're prepared for patient interactions and coming up with differentials, et cetera, and going into intern year, which I feel like is a hard transition in itself. But I feel like pathology is, you have to go back to, second year of medical school when you're learning pathology and looking at slides, and then skipping over years 3 and 4 where you're not really doing that, and then you go back to doing this again. How difficult was that transition for you?
It's still very difficult. I want to stress to any medical students watching right now, like you're reading Robbins, you're doing your coursework, you're looking at PowerPoints and lectures and images. That pathology course, whether it's split into 2 semesters or whatever you want, is like 1/10 of what pathology is. It's so much deeper and so much like broader that the learning curve of like getting to do the actual work, because that's the transition. Is you're not a student anymore. You're writing notes in Epic, you're doing stuff, you're ordering things, and you're making things happen with your name at the bottom of that thing under supervision. But it's a big transition.
Yeah, I can't imagine how difficult that is. I thought it was hard going from, patient interactions, formulating differentials, learning how to type my own notes, and then going into essentially doing the same thing, but with more patients and a paid position.
Oh yeah. Depending on
Like,
where you find yourself, some of us in Path still see patients actually.
okay.
If you go into something like heme path or transfusion medicine, like I said, bone marrows, right? That's one way to see them in procedure. transfusion medicine, you run apheresis clinics, you see them there. So you really still have to keep that clinical knowledge because you're advising your clinical facing, patient facing colleagues on how to do stuff, but you're
Right.
also responsible on your own end.
Yeah, which I think is very interesting about pathology and also radiology. It's like you learn to read either like the slides or the images, and really like it's the backbone of medicine. Like everybody's making clinical decisions based off of those two pieces of information because, Lord knows we don't know how to do that. So
Yeah.
much credit to you guys.
Yeah. The statistic is like 70% of patient information comes in the form of some kind of diagnostic data,
Right.
labs, imaging, whatever. And virtually 99% of cancer diagnoses come through us.
That's absolutely incredible. Absolutely incredible. And
We try.
I think sometimes people forget that there's like a background too, like, oh, you get these test results back, but there's someone back there doing all the work. So much credit to you guys because
Yep.
that is impressive. So it sounds like you've been interested in path for quite some time. You had some experience in laboratory medicine and pathology before you even went to medical school. What did you do when you were particularly in basic sciences, to help strengthen your application to make sure that you were going to match into residency?
For me, and I can speak advice to anybody who's interested in any specialty, but what worked for me was to find a way to do two things: to connect with the faculty in your school who represent whatever field you may be interested at that point. And if you're not sure of what you want yet, that's okay in that timeline. But I knew Path, and I got to know my Path faculty really well, connected with them, worked with them. I didn't want to be a stranger, in case I needed anything from them. And that's always a smart idea. And the second part is you need to find a way to stand out. And that doesn't always mean you have to do something within your specialty. I got really lucky to have good enough grades in medical school. I wasn't great. I always joke that I've always been on the assistant dean's list. Doesn't exist. But like I'm a solid like B student. No matter what you do to me, I'm never going to be perfect, right? And that's okay. But I was lucky enough to have good enough grades to do an elective class in sort of public health and service learning. And I got to work with a completely different faculty in like social science and kind of use skills in, my pathology data and diagnostic experience before medical school to like do public health work and reach out and do advocacy and education and kind of, stick out that way and make myself, different than anybody else. And the team I worked with, the other medical students and the faculty were great. And we all talk about this forever. It was about Zika interventions while we were in the Caribbean when it was like a epidemic. And it was really special, really important. And I think everybody should always be seeking out something that excites them to do that.
Yeah, that's I think the most important thing that I try to convey to people as well is that your application enhancers, essentially the things you're doing to make you stand out, don't have to be related to what you are applying for. If
Yeah.
you are applying to pediatrics, you can still volunteer in things that you enjoy that might be more related to your hobbies than they actually are to pediatrics. And this particular sounds like a very cool, more so microbiology related, I guess, than actual pathology, but very, very cool. And definitely super cool that you were in the Caribbean when the Zika virus was actually like happening. That's a very cool initiative to be a part of.
Great timing. I actually had Zika.
Oh no. I mean, I
Yeah.
heard it's pretty bad, but I haven't
Okay.
had it myself.
It was not great.
I know a friend who had chikungunya, but nobody I know who had Zika. Now I know
My,
someone who had Zika.
my wife actually had Zika and chikungunya.
Ooh, the
That was not.
Mustangs sound very real.
Yeah. Yeah. She reminds me.
Not great. And how about, do you have any specific advice for clinical years, or would you kind of advise the same thing?
That advice holds true no matter where you are in your career. I think it's important to always find something that sparks your joy and interest and passion and to do something with that energy out. And, if you're interested, keep pushing yourself to a higher and higher professional level. Clinically, for students in their third and fourth years, obviously you want to seek out electives that help you and help your application and ERAS and all that stuff. But clinicals is a great experience or a time to get your foot in the door with publishing a case report or putting together a poster or some kind of, traditional academic work that isn't, part of the first 2 years.
Fair. And I think just another question I have for you. So in terms of being in clinical sciences and knowing you wanted to do pathology and knowing that while there is some patient interaction involved with pathology, it's not nearly as much as it is in almost every other specialty except maybe radiology.
Absolutely true.
How
Yeah.
did you, I guess, cope with this during third and fourth year? Or do you just feel like you're generally enthusiastic about all areas of medicine, so it didn't really bother you as much?
I wouldn't say I'm enthusiastic about all aspects of medicine. I won't tell you which ones I don't like, but
Okay.
but I you know, as somebody who's interested in path, I often heard the same like two or three statements from attendings and other clinicians all the time. You're so good with people, why would you want to go to the lab? You're, personable, patients like you, why it's such a waste and blah blah blah. But everything kind of is related, right? So if you're interested in peds, you're interested in internal medicine. If you're interested in, you know, I don't know, geriatrics, you're interested in, palliative care or microbiology or surgery. They're all interconnected and we're all kind of working in the same, boat. So it was a chance for me to strengthen and make the foundations of what I want to do more, complex and comprehensive.
That's very interesting. I always wondered that. Speaking of Path Lab being a quiet place, how do you go about standing out and getting letters of recommendation in these rotations? I feel like there's not too much you can do in a rotation to stand out unless you like automatically are great at, reading the slides.
In a pathology elective, there are plenty of chances to impress people. I don't know if anybody watching this follows like Dr. Glaucomafin on social media, right?
I follow him on Twitter.
Yeah, he's hilarious, first of all.
He
Second
is
of all,
hilarious.
he's lately been posting a lot of, subspecialty med student inspirations about how different people work. And there was a path one, and he said like one of the attendings like sent the med student down to look at slides. The med student goes down, knocks on the door and says, "Hi, I'm the med student. I'm here to look at slides." Pathologist looks up from his microscope and says, "Hey, we've got a med student." He tells his colleague, he tells his secretary, he gets him a hot cocoa, sits him down in the only chair, gives him a blanket. Everybody cancels grand rounds. They want to meet the med student. That's how path is. It really is so accurate. We love anyone who's interested in path. So if you express an interest in it, you're 80% of the way there. It's a fun, sad, and not so sad, statistic, but we just love an enthusiasm for the work we do because it feels so underrepresented, underappreciated sometimes, and it's great to get some exposure. And there's a lot of us who are in the pathology community who are trying to advocate more for, patient advocacy. I'm on some patient advocacy advisory boards and professional societies. I'm in social media, manager for different professional societies as we reach out and kind of publish our work and our impact on direct patient care. And something that's happening this year is the implementation of something called the Cures Act, which is going to allow direct patient access in a more robust way than ever before directly to their charted information. That includes pathology reports and imaging and lab results before their subspecialist or primary care clinician sees it. So our phone calls are going to be ringing, or our phones are going to be ringing, and we're going to
very much so.
Yeah.
What does this long word mean?
What the heck does FIGO 2 grade adenocarcinoma mean? Am I gone? Do I have months? And we're going to have to explain a lot of stuff. And over the last 20 years, a lot of us have been talking about pathology explanation clinics where we have sort of office hours to greet patients directly and talk about what their diagnosis means. And the world of medicine is changing a lot. And I wouldn't have picked any other specialty to kind of ride that wave in.
That is very inspiring. In terms of being in your pathology elective fourth year, or I guess end of third year, depending on your school schedule, what do you feel like your attending's expectations of you are in order for them to write you a letter of recommendation? It's very easy to say, like on the wards during a medicine rotation or pediatrics, they want you to be good with patients, learn to take a history and physical. And if you do those things pretty well and you show some effort, then you can pretty much get a decent letter of recommendation. But what are your pathology attendings looking for?
Yeah. I kind of half answered your previous question about sticking out during an elective. So
That's okay.
this is the same thing. But still, it holds true. 80% of it is showing a genuine interest, right? And pathology may be different than a lot of patient-facing specialties, but in most respect, it's not. Every slide, every lab test, every case you look through is still a patient waiting for result, waiting for the next step. And if you treat it that way, and if you show your attendings that you are seriously treating it that way by looking histories up of cases you've been expected to look at, knowing, what it means when we get to a certain diagnosis afterwards, that shows them that you have a genuine interest. Just being handed a slide from a colonoscopy, looking at it, matching it with a picture that says tubular adenoma and giving it back is boring and true, but it doesn't really get anybody's fire going. Getting the same slide, looking up why they got a colonoscopy, what the clinician's trying to rule out, their patient history, medical history, prescription history, all that stuff, and having a discussion about what tubular adenoma is and its respect for, high risk cancer in the future. That's a much different experience than kind of being a bored med student floating through an elective. Interest is key. Pathology attendings have no expectations of first-year residents, fourth-year med students, third-year med students, because they know the learning curve is steep.
Right.
And like I said, 1% of it gets covered in your second year. So the bar is really low.
I mean, I feel like that's the common consensus for most first-year residents, but
yeah.
I think especially in pathology when you
Yeah.
learn next to nothing in medical school. Honestly.
Genuine interest is where you meet them.
Good to know. Very, very helpful information. I think you're right. I think a lot of people tend to, and I think it's easily comparable to surgery, right? Because in surgery, it's even for a surgeon, it is boring to just go in, slice and dice, but you need to know what most surgeons won't let you scrub in if you know nothing about the patient. If you don't know at least their name and age, they won't let you scrub in, let alone why they're getting the surgery, if they've had previous surgeries before, if they've had any imaging that shows any anatomical differences. I think that it sounds very comparable to that aspect of surgery. So I think a lot of people could benefit from that comparison to understand it's more than just the actual looking at slides or the actual cutting and suturing. It's really about the whole patient.
That is an excellent corollary. And we didn't even get into surgical pathology.
Right.
Yes, you are absolutely correct.
I'm just very impressed by the fact that only 1% is covered in medical school. Although I feel like maybe only 5% is covered in medical school for other specialties. I'm just still stuck on.
Oh yeah. It's all cursory. It's all general. But something common to most pathology programs when you interview and you go on the trail or on your computer for Zoom meetings, because the world has changed, is you compare what your book fund is. And most residencies have a book fund because you're going to need to amass a library very quickly because you're going to have, I'm a pathologist. This is my home desk, right? Those are New England Journal of Medicine. Those are some pathology books down there behind me. That's my home microscope. Not everybody has one. I'm fancy. But at my work desk, it's pathology this, surgical this, breast pathology, GI pathology, hematopathology, because you need to have that primary resource right there.
Accessible,
and,
yeah.
Yeah, and when you're in the elevator with your surgeon who has taken out that lumpectomy for a breast cancer case, they may ask you a question and you've got to have the answer. Right.
And, I have to say, now that you brought it up, I don't feel as bad. I was trying to wait to the end to compliment your home office. But that's what I aspire that my home office will look like in the future. I want my degrees hanging up in the back. I want to have a big library. I never considered the microscope, but now I might add that to the list. I'm not going to lie. I probably won't use it, but it would make for nice decoration.
I don't use it a lot, but it looks, yeah. I am flattered. You got to have a good shelfie nowadays, right? That's what they call it, shelfies.
Yeah.
Yeah.
Gonna need one of those in the future. I'm inspired. In terms of electives, we were kind of just touching on electives during fourth year. How many did you do? Did you do any auditions? And did you wind up matching at a place where you did do an audition?
I did 2 dedicated pathology rotations that were electives. They weren't really auditions. I mean, I guess every rotation you do is an audition, right? Yes and
That's
no.
fair.
But I did 2 pathology electives at the very opposite end of the spectrum, right? I did one at a very high rank, prestigious tertiary academic medical center with lots of resources and whatever at Mayo Clinic in Rochester, Minnesota. And I did another rotation at a small 2 resident per year community-based pathology practice that was still some academic, but mostly community-based at Danbury, Connecticut.
Okay.
And the difference between those two, is stark as far as volume and resources, but it's the same type of work with the same type of passion. So I got to see a big range and spectrum of cases. So rare stuff goes one way, community stuff gets the other stuff. But it really shaped a lot of my conversation points when I started talking to residency interviewers.
Yeah, for sure. And I think that's one thing I actually tried to do as a fourth year student as well. I did most of my third year in New York City, where you get we got experience like in community hospitals, high volume of patients in the city. Most of them, honestly, pretty underserved in terms of healthcare access. And then in fourth year, I went down to Florida in a very rural, fancy hospital. Suburban, rural, I guess. I don't really know what we would consider
Yeah.
it, but it was very, very interesting. And I think important for a medical student to see the difference in the two, because you're right. I mean, the pathophysiology isn't going to change, but I think it's very important to see the differences in like health insurance and access to care and all of those what we would call hidden curriculum type things that you don't necessarily get access to if you do all of your rotations in one location. So I think that's a good point that you brought up as well that I haven't touched on in quite a bit.
Yep. And I'll add something to that. That goes back to one of your previous questions about what to do to stand out. I also trained my third and fourth year for the most part in New York, mostly in the Bronx, some in Brooklyn, some in Staten Island, but mostly in the Bronx, especially for my core rotations. I I think it's important, like for myself, for example, I was interested in path. Every hospital I went to, I would go to the pathology department and meet them and just, hey, I'm interested in pathology. You've got a med student here that likes what you do. And every time I was pretty much almost greeted with hot cocoa and a blanket every time. But it also provided me several opportunities to really prove, cut it with them. Because I remember one time in Brooklyn, there was this whole like computer network fiasco with their medical record and their charting and stuff. And they were having lots of issues. I was on an emergency medicine rotation and they couldn't get any lab results. So what do you do in the lab when you can't get a troponin, when you can't get a blood sugar, when you can't get a UTOX? I worked with the lab team to sort of figure out a way to run those paper printed hard copy results back and forth in a way that used sort of my experience as lab manager from a previous life and medical student interested in doing XYZ. I've written about a lot of these experiences on a blog for the American Society for Clinical Pathology when I was a medical student. I've been writing every month since I started like medical school in the Caribbean. And I'll give you the link sometime you could share it, but like it has a lot of examples of what you can do to like connect your interest with what you're doing and where you are and what you have available.
That's really cool. Yeah, send me that link and I'll actually include it in the description when I post the video too, so that people can just click on it. That sounds
Thanks.
like a really good resource. The other thing that will kind of stem from this conversation too is that one of the things that I often tell people in like third year of medical school, like, sure, there are days where you're going to be there long or you're going to be, someone will forget to dismiss you and you wind up being there for way too long. But there will also be days where you're dismissed early. And so if you're interested in something that's not a core rotation or that you don't get like a lot of experience with in medical school in general, for example, anesthesia, our anesthesia knowledge is very limited in medical school. Same with pathology. And even arguably like things like interventional radiology, but all three of these areas and arguably more, these are good opportunities that you can take to just go down and meet the staff and just let them know that you're interested. Most people are not going to turn away someone who is interested, even if it's just standing on the side and getting a feel for what they actually do. You never know what's going to like spark your interest. So I think like, I mean, for me, like, honestly, I don't even know if I'm interested in pathology because I've never done an elective. And I don't think I was in the path lab one time. I was in a surgery and we were excising basal cell carcinoma of the eyelid. And the surgeon wanted to make sure we had clear margins. So he sent the medical students down to the pathology lab to check it out with the pathologist. So that was a very cool experience. But I think most medical students have never been to the path lab, so they don't even know if they're interested in that. It's very hard to know if you're even interested in anesthesia because we don't get experience of those things. So on those days that you're dismissed early, there will be plenty. Take some of them to go home and study for shelf, and take some of them to go and explore different areas of the hospital. Most people are not going to turn you away if you are expressing some type of interest.
Absolutely. And there are many, many resources out there available to anybody interested in like any specialty, really. I know my mentor at the hospital I'm at has been part of a team that put out pathology related elective content because the pandemic kind of ruined people's ability to come and see things in person. So
Right.
I'll give you the link to that as well if you want to share that.
Perfect. Yeah, that would be great.
But yeah, showing interest, it's up to the individual, really. If you have time, if you have energy, go ahead and do it. I'm a big advocate of taking a break. I'm a big advocate of going home and getting some rest.
Samesies.
Right. But if you have the space and the capacity to sort of do what you said and just be there, just to be there, I think that goes a long way. Yeah.
Yeah, I agree. So a question that I often get is, what do my step scores need to be to match into X, Y, and Z residency? I looked up the average path score for step one, and it looks like it's around 230, 232-ish. How did you do in comparison to this? And do you think that it played a large role in you getting interviews as a Caribbean medical student?
It's a good question. It's an important question because it doesn't matter. The older I get, which I get older every day very quickly, is I learned that stuff doesn't matter. Okay. It sometimes matters, but most of the time it doesn't matter. I will tell you, and anybody listening and watching, the first thing first, that I got a 218, I think, or 216 on step one. That sucks, right? That is not a competitive score. Do I think that some programs that I really liked filtered me out because of that number? Yes. Do I think that I was able to impress people around the country when I was on my campaign trail, regardless of that number? Yes. So it ended up being important, but not important, because when you find the place that is best for you, they're going to do what they can to fight for you if they really want you in that program. And they will look at your whole application, not just the number that a computer spit out because you spent 6 hours at a testing center. So, grades do matter. Try to do your best, but that's not going to be the score that gets like tattooed on your arm for your life. It's okay.
Yeah, I agree. I think, yes, you will always get filtered out, unfortunately. One, by your step score by some programs, unfortunately. Two, because you went to an international school, unfortunately. But there is more to you than that. And as I'm sitting here talking to you, I'm like, oh, wow, I would love to have him as one of my co-residents. So I can imagine that you impressed program directors and assistant program directors on the interview trail. I am not surprised by that whatsoever. But yeah, I think that's an important thing for people to remember as well, is that you are a lot more than your step score. Do your best. But, crap happens.
Yeah. And likewise, I'm talking to you as well. We all have the capacity to do this sort of thing. That's why we're in medical school. That's why we're trying and struggling and suffering and sacrificing your youth. But this has nothing to do with me or my talents or you or your talents as a showman to impress people. It's about work, and it's about if you really have the passion to continue a career in this field. That's really what it comes down to.
Yeah, I agree. And I think this is a whole separate tangent that I could go on. But even as someone who did do well on step one, I think the purpose of step one scores now is not what it was developed for. Step one was developed to measure whether or not you have the minimum knowledge required to practice as a physician, whether that means you get the 196 that's barely passing or a 260 that's close to the highest you can get. Everything in between there, it doesn't matter. you passed the threshold, and that's all that it was meant to be. So keep that in mind when you're remembering that,
Well, now it's pass fail.
Stuff. Yes, it is moving towards pass fail, which I think is good for a lot of people's mental health. And so I know you did have some research experience going into medical school and also going into residency. For those who might be applying to pathology, who either are wondering if they should get some research or if they don't have any at all when they're applying, how important do you feel that research is for your overall application?
That's a good question. If you look at the NRMP reports about different specialties, it'll say like most applicants that are successful in matching in path have like 1, 2, 3 papers with their name on them, but a lot don't, and that's okay. I think the expectation of attendings and program directors on applicants and third or fourth year students is reasonable. I think they understand that you can't have had and a lot of exposure to pathology, that you can't have had the time to really publish any plenary papers of any significance except for maybe a case report if you got lucky. But they know how med school works. And it basically pretty much comes down to the way you kind of move through that interview process. If you have the time and space and capacity, like I said, to impress people and turn it into a publication, that's great. Good for you. You've been vetted and approved by, a reviewer number 1 and reviewer number 2 somewhere that puts your name out there officially. But if you haven't, you can still find opportunities to do posters within your school or programs within your community or something that you can put on your ERAS in some way that shows that you have capacity for, outreach, advocacy, teaching, education, and something that just makes you stand out.
I think that's very good advice. I try and tell people that instead of hyper focusing on one area, like research, which most medical students tend to hyper focus on, and they think they need, 16 publications by the time they apply to residency, which is completely not plausible whatsoever, given our time constraints. I think that it's really important to focus on having an overall well-rounded application rather than hyper-focusing on pumping out the papers. Unless you're really passionate about research and you're very, very interested. In that case, pump out all the papers because you love doing it. But if you don't enjoy it, I don't think you'll be turned away because you don't like doing research. Many people don't.
I agree. And listen, we're in school for a professional medical doctorate, MD or DO. We're not in a PhD program to be an academic. That's okay.
Yeah.
Publishing case reports are helpful, but they're not going to change the world.
Yes, exactly. Agreed. So now kind of moving on to the latter segment of the interview, which is my favorite thing to talk about, which is interviews.
Hey.
Tell me about your interview experience. How were PATH interviews in general? I'm assuming they were not terribly stressful after you get past the first 1 or 2, and they probably offered you some hot cocoa and a warm blanket, but I would love to hear what they were actually like.
Once upon a time, there wasn't a global viral pandemic.
Right.
And there were things like food and shared experiences without masks and all that kind of good stuff. Maybe we'll get back there one day, but I had a great experience on what I called earlier my, right? The
campaign trail.
Loyola was actually the first interview I went on. I should have stopped and checked out. Saved myself a lot of cash on travel, but I learned a lot more about the field of pathology during my interviews than I thought I knew before I started. And that's really helpful. And I interviewed at great small places that surprised the heck out of me. And I interviewed at large malignant places that I wouldn't dream of even revisiting as a patient, right? I won't name and shame. But you learn a lot about yourself as an applicant and what the field is all about. And what I can say about interviews is that you're going to get asked a lot of the same questions over and over and over again. And that's fine. You have to remember not to be bored by yourself. It's a great tip, but you're going to be thrown some curveballs here and there that are going to catch you and stop you in your tracks. And you're going to have to really think on your feet. So be ready for that kind of experience.
It's a very, very good point, not to be bored with yourself, because I feel like by the end of interview season, I was just pressing play on my little record that I had spinning around.
Yep.
It was bad. What was your most commonly asked interview question in PATH?
Why pathology? It's such a filter. It's it's looking for your genuine interest. If you answer it because, oh, I don't know, I like this specialty and this specialty, you're applying to Path as a backup, and everybody
Right.
knows it. Right. And everybody knows it. And that's okay. That's not a bad thing, but they know. It just puts you in a different box. If you say, I've worked for 10 years in this and I love this and I have interest in this and I really want to do this. Well, Dr. Kanakis, I think I understand that you want to do Path. Most common questions are going to be the most common questions you're going to get for any specialty. What makes you special? How was your experience at a Caribbean school, let's say? What about XYZ on your application? Tell me about this. Tell me about a time where you were this. Tell me about this. And you can't do anything but not be bored with yourself.
Yeah, that's true. And it's funny because every time I ask this when I do an interview, it's the same answer over and over again. It's either tell me about yourself, and try not to be bored by telling me about yourself. Why this specialty? And I think if you can just answer those two questions alone and very passionately and convey your interest in yourself and also in your specialty, I think that is going to be, they're the two big filter questions that programs have for you. Everything beyond that, even if you don't answer them so well, I don't think it's as big of a deal as long as you can answer those two questions solidly.
There's one additional tip I'll add.
Yeah.
For a lot of us, I had working experience before medical school, so this doesn't apply to me, but for a lot of us, residency is going to be your first job, real job, right? It's school, all the way from kindergarten to being an intern, and that's terrifying. So what happens is we think that we need to impress them beyond belief and we owe them all the answers, and we just are thankful that we have the opportunity to exist in the presence of a residency. You need to have filter questions too.
Yeah, agreed.
You need to ask questions that push the envelope too, and you got to do your research before you walk into a hospital, just like you have to know why the patient's on that gurney in the surgery suite. So I would ask questions that say, like, what's the worst thing about this program that you've heard from residents? Or what things are you working on to improve? Or for one specific example, without naming anything, I was like, why did you lose your residency accreditation in 2015? Uh-oh. They stopped, they wanted to know, like, who is this person that knows how to look stuff up on NRMP, which is public information. Nothing's fancy. We're adults. This is a job interview. Show them that you know things. Show them that you know how to operate in a professional and, apt way. And it's going to go a long way.
Yeah, that's a really good point. Doing research before the interview is key, and ultimately, like I always tell people, it goes both ways. Like, yeah, sure, it's stressful because they're interviewing you. It may be essentially your first job interview. Maybe you've never had one before, and ultimately, like, they do get to come up with a rank list, but don't forget that so do you.
Yeah.
You get to come up with a rank list, and those questions that you ask on interviews are going to be the way you narrow down your rank list and decide where you ultimately want to be. So make sure you know what's important to you and you have good questions to ask on interview day to figure out if you actually want to be there or not, and if they're actually going to get you to your final goal as well.
True.
And you kind of already touched on what you think program directors are looking for in applicants. It sounds like they're looking for someone who's just well-rounded and just fits in well with the program, which I think is pretty consistent across all specialties. But do you have anything to add from that aspect?
No, just in medicine, I would say that good program directors will also try to see, if you fit within the culture of the hospital and the program that you're talking about, because they often have mentor programs, or they often have ways to see if you're interested in growing and developing your career trajectory, and if they can offer you something. If that doesn't come up, they either don't have a program or they don't have a strong enough experience that way. But keep an ear out for programs that are interested about your goals. You put it really well.
Yeah. And then the last question that I have for you is, you already mentioned two great resources, it sounds like, so far. Do you have any other resources for applicants who are interested in learning a little bit more about pathology, or maybe are considering pathology, but they're just not really sure?
Yes. I have been fortunate enough to get on the surfboard right before the tsunami of social media has exploded pathology out of this invisible, metaphorical basement and out into the spotlight of a good, promising specialty. If you go on Twitter, there are hashtags like, Path to Pathology or Path Match and the year, like Path Match 22 next year. There's a lot of pathologists on Twitter. Med Twitter is huge. Path Twitter is just as big. Instagram, Facebook, Snapchat. There are TikTok videos with lots of pathologists doing stuff. There are folks that really care about this who are young enough nowadays to be able to actually use the things that they couldn't use like 10 years before.
Yeah, right. It was so frowned upon to have social media a couple years ago. It was like, you're never going to get a job. And now like my job is encouraging me to use Med Twitter.
Yeah, exactly. So there's a lot of pathology on social media. I encourage anybody interested to seek it out or seek me out from the handle that you share, and look at different pathology related electives that exist online. There's tons of them.
Yeah, that's really, really helpful. I think that will benefit a lot of people. And if you don't mind sharing afterwards some of the handles that you like to follow with me or your favorite path accounts, I'm looking to expand my Med Twitter base so that I'm making my scrolling more productive. So I would appreciate all of the path accounts that you love to follow.
You got it.
And then last thing is, do you have anything else that we didn't touch on that you want those interested in pathology to know, or anything that you think that might help them along the road?
Just one or two things, I think. You mentioned briefly, like, it's going to be difficult for anybody because whether your score filters you out or the fact that you went to a IMG school filters or FMG school filters you out is a reality. In some places, yeah, that's kind of a sad reality, but don't let it be. There are a million medical schools in the world. I don't know how many there are. That's probably close to it. Some better than others, some great, some not so great, but they all spit out a DO, an MD, an MBBS, whatever you want to call it. And at the end of the day, we're all in the same boat, like I said really early in our talk. If your work and your experience and your application are no different than somebody who went to the state school in the same program state that you're in applying for or in an interview for, that speaks volumes. We all have a different path. Mine, like I told you about, is long and winding. Most people's aren't. So it doesn't matter where you went. It really doesn't matter. There are a million schools in the world. And second, you mentioned that behind every test or whatever, there's a team of people doing stuff, laboratory scientists, pathologist assistants, pathologists, MDs and stuff, radiologists, techs, people in these invisible roles that make the healthcare ship stay afloat. It's important to show your appreciation for them when you're a student on the floor. It's important to remember them when you're going through your own experience. And it's important to remember that even though a specialty is not visible or patient-facing, like radiology or pathology, doesn't mean that we don't have a very large impact on your work, however removed you might be from our microscope or our CT machine.
That is amazing closing words. I feel like I should say nothing less because that was a wonderful ending statement. So thank you so much for taking the time out of your busy schedule with your steep learning curve to come and share about pathology with us. You are clearly very passionate about what you're doing, and I am very inspired by our talk today.
Thank you very much for having me. I really enjoy talking about this, and I wish all applicants and students listening to this nothing but the best, and good luck.